I'm Dr. William Horton, and I'm an otolaryngologist or ENT physician here at Greater Knoxville ENT. My interest is in rhinology, which is the diseases of the nose, such as allergy, sinusitis, smell, and others. Today I'm going to be talking about sinusitis, and in particular, chronic sinusitis. Sinusitis is an incredibly common disorder that affects millions of people. About 270 million visits per year to a primary care physician for sinusitis. Chronic sinusitis is a bit different. Chronic sinusitis is defined as sinusitis that lasts for 12 weeks or more, or a different type of it is 4 episodes of sinusitis in a given year that the patient is clear between the episodes. Chronic sinusitis affects about 20 million people a year, or about 15% of the population. There are several types of chronic sinusitis that you have to know about, and treatment is different depending on which one you have. The chronic sinusitis is primarily differentiated into 2 types. One is chronic sinusitis with nasal polyps, and one is chronic sinusitis without nasal polyps. They do have different etiologies or causes and are actually treated very differently. Chronic sinusitis that does not have nasal polyps can be treated in a number of ways. These are the ones that are recurrent for more episodes per year or that persist for more than 12 weeks. And if they do not have polyps, there are several options, including balloon sinuplasty and standard or functional endoscopic sinus surgery. This is a minimally invasive procedure, but it is done in the operating room, whereas balloon sinuplasty is typically done in the office. The type of sinusitis that I want to talk a little bit more about today, however, is chronic sinusitis with nasal polyps. And this is a distinct disorder that is also very common. Chronic sinusitis with nasal polyps is often associated with asthma. So people with asthma who have difficulty controlling their asthma often have comorbid conditions, and chronic sinusitis with nasal polyp would be that condition. The first step in treating sinusitis with nasal polyps, of course, is to establish a diagnosis. Once we know that this is the condition we're treating, we'll typically treat this with steroids, prednisone for some short period of time, and a nasal steroid like fluticasone, Flonase, for a longer period of time, and usually at a higher rate, such as twice a day as opposed to once a day. The treatment of the polyps is often successful, but if it is not, the next step of treatment is typically sinus surgery. Sinus surgery for nasal polyps is usually more extensive than the sinus surgery that we do for sinusitis without nasal polyps. For the patients who don't respond well to surgery, there would be treatment with one of the biologics, either Dupixent or Nucala. These are very effective treatments, and my patients that recur after their surgery do very well with that. You can discuss with your surgeon whether or not you're a candidate for Dupixent or Nucala on the front end, or whether you would best be treated with surgery. Again, the surgery is very effective in about 60% of the patients, and it is a long-term cure. But in those that don't, we now have a medication or 2 medications that are very effective and my patients are very happy with.